from, again, there's no name, it just says Lungexcerciser. Any common exercise or medication or food precaution that you'd recommend that will help in the recovery of lung capacity or fatigue?
So exercise would be, as you asked, and probably we can demonstrate it now, is something where we need to do physical activity, as I mentioned some time back, basic mobility exercises, which you need to keep on doing even while you are recovering from the illness. And those can be very simple hand and leg movement exercises, which we eventually make you progress to a higher intense activities, depending on how your parameters are responding. But along with that, you can think of doing some basic breathing exercises, whereby so these are, I think I just mentioned some time back. So basically we can use a lung exerciser. As you can see in this picture over here, this person is using this lung exerciser machine, which is basically helping him to exercise his lungs by breathing in deeply. So I have got one more option over here. So I have got this lung exerciser. Okay, this is another variety of the same type. All right, whereby I just have to simply, so you can see there's a ball inside, and these are available at the chemist shop very readily. Okay, easily. So you can just buy this lung exerciser, and there are different resistance levels which are there on this, which will basically make my breathing more difficult. So I need to really apply more force to suck in the air and keep that ball hanging in the air for a longer period of time. All right, so if I just suck in like this, so now it all depends on my lung capacity. How long can I keep that ball hanging in? So how forcefully can I breathe in? And if I keep on repeating this multiple times in the day, so we say normally at each time you can do roughly 5 to 10 times and do that 2 to 3 times in a day. This will automatically become a good lung exercise, where you are making your lungs work to breathe in more deeply, to force that ball to stay up in the air. All right. And the similar is that other device which you can see in the picture. So that's one lung exercise which we can do. There are other breathing exercises which we can think of doing. One is called as the thoracic breathing, whereby I can simply put my hands on the chest and I try to breathe in deeply. And when I breathe in, I should observe my chest bulging outwards. Okay, so basically we are trying to focus on the upper part of the lungs. And your placing of the hand helps you to identify how much of your lungs are moving in and out. So something I can breathe out through my mouth. So this is what we call it as a thoracic breathing, which will help to exercise your lungs. Okay, the upper part of the lungs. Now, if I want to exercise the lower part of the lungs, what we call it as the diaphragmatic breathing. This diaphragm is nothing but a respiratory muscle. So I can simply place my hand on the side of the chest, just at the junction of the chest and the abdomen. And as I breathe in deeply, I should observe my hands widening outwards. So what I'm trying to do is to expand my thoracic cage outwards. Again, increasing, helping my lungs to expand better and get in more air. Okay, so you keep your hands here. So this is what we call it as the diaphragmatic breathing. And the third breathing we can do is an abdominal breathing, where you try to place your hands on the abdomen. So I hope you can see me, Anuj. So I'm just placing my hands on the abdomen. And now as I breathe in, I should expect my abdomen to bulge outwards. So now we are focusing on the abdominal part. Now, these are very simple, basic breathing exercises, okay? Now, which something everyone can do to improve their lung function, especially when you have got infected and you are positive and are recovering. So these breathing exercises, say 10 times each time and probably 2 to 3 times in a day, will be a good addition to your medications, apart from the physical activity that. Okay, so I think these are basic things what you can keep on doing while you are at home.